Face masks will become mandatory for residents of Melbourne and the Mitchell Shire from midnight tonight, but the New South Wales Premier has ruled out enforcing a similar move in her state. And the Premier Gladys Berejiklian joins us now. Premier, good morning.
Good morning, Michael. And can I be clear? It's not that I've ruled it out, but it's based on our health advice in New South Wales, and that's really important. It would be not the right thing for elected members of Parliament to make up policy, but for us to take the health advice in our state. OK,
would you consider making masks mandatory on public transport? The Rail Tram Bus Union says it's unsafe for its staff members when you're talking about buses and trains, people crammed very closely together, not to have passengers and staff members wearing masks on a mandatory basis.
Well, firstly, we've ensured that we have what we call green dots on our buses and trains and all our public transport services, which recommend where people should sit. And if you don't have a green dot, we recommend you don't catch that service. But if you happen to be in a situation where people aren't respecting social distancing, where you do experience crowding, of course you should wear a mask. And that's been our advice from day one. And it's not just related to public transport, it's related to any situation. If you feel you're going to be in a situation where people around you or yourself aren't going to be able to respect the social distancing requirements, then you should be wearing a mask. And that's been the consistent advice from day one, and it remains the advice. And we know that on most of our services that people are respecting the green dots, because we've reduced capacity in our system by about 50% to make sure that there's social distancing on board our buses and trains in particular. But if you feel that your service means people are getting too complacent or too many people are getting on, well then in that case you should be wearing a mask. OK, take us through the latest situation regarding the infection situation in New South Wales, and how concerned are you, for instance, about Port Stephens? Well, look, we remain concerned. We remain on high alert. But the one positive takeout for us is that yesterday it was confirmed that all the clusters we have in New South Wales at the moment do have the same genomic sequencing, which means at this stage we've not found anything which is a new situation, a new cluster. It's all from the same source, the same genomic sequencing. So that gives us a degree of comfort. But of course, our state remains on high alert. And I've been saying to our citizens, be extra cautious. Don't move around unless you have to. Be careful about what you're intending to do over the weekend. Avoid large crowds. And these are just sensible bits of advice to give people, in addition to the additional restrictions we've put in place, which come into effect on Friday as well, in relation to hospitality venues. OK, now can you clarify something? New South Wales Health has apparently asked or advised New South Wales residents who have taken a COVID test, tested negative, but to still self-isolate for 14 days afterwards. Is that now the case? Yes, but that is not new policy. That's always been the policy. That's why in New South Wales we've had 14 days of hotel quarantine, because when you come in on day 2 you might be negative, but then on day 10 you might be positive. So that's always been our position in New South Wales, and I'm glad that issue has been getting attention, because being negative doesn't mean that you're out of the woods. It means you still need to stay home for 14 days from the time of exposure, because the disease can come up, it can become infectious in you during that time, and that's why the strict health advice is even if your test comes back negative, you need to be home 14 days from the time that you were exposed. OK, now it's great what you say about community transmission in New South Wales, being able to connect all those dots. When I spoke to you on 7:30 a week ago, you made it very clear that you weren't a fan of hotspot lockdowns, but if the health advice came to you and said, Premier, we have to lock down parts of Sydney, other parts of New South Wales, you'd clearly do that, wouldn't you? Oh, look, of course we'd take health advice. But what we also need to remember is when people attend a venue, it's not necessarily people who live in that locality. They might be coming from suburbs all across the place. Similarly, if there's a breakout in a regional community, it may have occurred that people from outside that community have been visiting that venue. So, you know, all these policies have their limitations, and what we need to do is rely on the health advice, but also deal with things in a risk-appropriate way. And so, New South Wales, we've taken a very strong position that if there's any venue, any establishment where we know there's been cases or exposure, we obviously shut that venue down, make sure it's been deep cleaned and make sure it's safe before it's reopened to the community. We also provide real-time information so that if people were there or that a direct contact of theirs was there during the times of the exposure, that everybody gets tested and stays home for 14 days. And that is so important. We are at a critical stage where we want to obviously control the spread in New South Wales, and that can only happen if all of us do the right thing. And I'm urging everybody in our state to consider what they're doing over the weekend. Limit your exposure to large crowds. Just be sensible, have common sense. If we get through the next few weeks in New South Wales and maintain what we have at this stage, we'll be in a position to continue moving forward. And we are definitely at a critical point. Our level of concern remains high. Our level of community messaging remains strong in terms of asking people to really consider their mobility over the weekend.
Okay, staying away from large crowds, so you'd argue going to, say, a football match would be inadvisable?
Well, there's a difference there in that if it's a seated, ticketed event where there's good social distancing, ironically, an event like that is more controlled than walking into a public space which may have a lot of people. So, and we also know the health risk is indoor events. So your home, somewhere you're going to eat, somewhere you're going to exercise indoors. They are the places which are the highest risk. Indoor, in close proximity to others, is the highest risk, and we're asking everybody to in particular be careful of that. Be wary of, you shouldn't be having large family gatherings, but be wary of large gatherings anywhere, including those venues, but also including your own home. Even though the health orders say you can have up to 20 in your home, the health advice this weekend is for people to consider not having any more than 10, and even then make sure nobody has symptoms and nobody has been exposed. Okay, and just finally, speaking of gatherings, what are your thoughts on the Black Lives Matter march scheduled to take place in Sydney on Tuesday? Well, my thoughts have been consistent. Irrespective of the issue, we need to follow the health advice. Large crowds are a huge concern. We cannot allow that march to continue, unfortunately. If people feel strongly about that issue, they're welcome to express their views in different ways, but it's just not sensible at this time to expose yourself and others to the spread of the virus. We're at a critical point in New South Wales, and we don't want to see the virus spread, and actions like that are a huge health risk. We ask everybody to take the health advice and express their views through different means which follow the health advice. Premier Gladys Berejiklian, thank you so much for joining us. Thank you, Michael.